Good afternoon. It's September 1st, 2023. Let's just dig right in. I'm going to say it very clearly. You go back 3.5 years, you will recall, most likely, that there was tremendous fear about asymptomatic transmission. Who might be lurking around the corner that was without symptoms, feeling well, but might be a super spreader, might transmit COVID to grandma, causing grandma's demise. There was an exaggerated fear of asymptomatic transmission, and it was fueled by a flawed PCR test. This led to policies that intruded on lives, including lockdowns, locking kids out of school, locking nursing home patients into facilities that were infested with disease, causing them to have horrific deaths, locking businesses down, mask mandates, vaccine papers and passports, the whole thing. Let's just unpack this. Why am I doing that? Because right now we're having remarkably a conversation about rinse and repeating some of these same failed policies from 3 years ago. So first off, asymptomatic transmission became a real fear in the first half of 2020. That might account for some leaders flipping from don't wear masks to, for heaven's sakes, wear masks. You remember those personalities, you remember those people. At first it was, you don't need to wear a mask. They don't work anyway. We've done previous studies, research, they don't work. And all of a sudden, we were told, wear a mask, any kind of mask, wear 2 masks, wear 3 masks, maybe 10 masks. Then we had the mask mandates. And if you didn't go along with the mask mandates, you couldn't go to class, you couldn't do this, you couldn't do this. Then when we had the vaccine in place, we had that. And we had the lockdowns along the way, and we had quarantines. We were quarantining healthy people. So let's just unpack this real quickly. But the key message here is exaggerated fear born out of concerns regarding asymptomatic spreaders, asymptomatic transmission, which was fueled by a very flawed, ridiculously problematic testing program, whereby literally if you cycled enough this PCR test, you could get someone's transmission fluid from their car to potentially test positive. Tony Fauci made the famous line, well, if you cycle threshold too many times, all you're going to get is, you're going to get a positive test and all you have is dead nucleotides. I think many people went on to say, we do not want to be mass testing everybody that comes in to the hospital or whatever. If they don't have symptoms, leave them alone, because what we were doing was we were literally seeing patients in the emergency room with broken legs, testing them for COVID, and if they were positive, COVID became one of the diagnoses on discharge. But anyway, let's unpack it. Let's look at it. Was it a problem? Well, let's just go back over an article by Jeffrey Kluger. This was in Time magazine, March 16th, 2020. Jeffrey Kluger, is ordering takeout unethical? A medical ethicist answers some of the most common moral questions around coronavirus. Here's an article whereby Time magazine spoke to Arthur Kaplan, director of the Division of Medical Ethics at New York University's Grossman School of Medicine. Questions and answers. Questions from Time magazine, answers from Arthur Kaplan. If I'm a young, healthy person and my city has not shut down entirely yet, should I stay in as part of social distancing, or should I go out and support local businesses and tip well at restaurants? His answer, you should stay in. You should not be sitting in groups in public places. Even if you're young and healthy, you're still at risk of turning into a disease vector who could infect others. Get the language there? It's almost as if every one of us was walking around was a weapon of mass destruction. He goes on to say, the businesses can take the 2 or 3 week shutdown better than grandma can take the virus. How did that 2 or 3 week shutdown work out for us? There's another question from Time magazine to Arthur Kaplan, renowned medical ethicist. Is it okay to have sex with my partner? No. I would say, unless you've just been tested and waited 5 days, that you shouldn't. Interesting. Is it ethical to go to your doctor for a non-urgent problem? No. It's better to postpone till later. I can tell you, as a family physician in the trenches, I saw a lot of folks wait till later. I've seen them diagnosed now with advanced breast cancer, advanced colon cancer, coronary artery disease that is no longer amenable to treatment with medication. but frequently involves open thoracotomies and bypasses. Is it ethical to rat out a friend or colleague who is showing symptoms and ignoring them? Kaplan's answer, yeah. I think in times of pandemic, yeah, I think it's okay. The snitch lines, remember? So we know what happened. We know there was an issue. Okay, now let's go to an article today. David Zweig, ZWEIG, his newsletter, The Silent Lunch. He says this, a study's bombshell finding that has been ignored. And he goes on to talk about an article that has been ignored and shouldn't have been. Here's what he says in his essay. Mask mandates are premised on a basic idea. A large portion of healthy people may unknowingly be infected with COVID and could transmit the virus to others. The results from a unique new study, however, call this logic into question. The paper published in the August issue of the journal, last month of the journal, The Lancet Microbe, found that infected people pre-symptomatically, meaning they're infected but they don't have any symptoms, pre-symptomatic, very rarely had the ability to infect others. It showed the limited ability of most people without symptoms to infect others. What this means is that compelling people without COVID symptoms to wear masks, quarantining healthy people, closing schools, and other social distancing measures likely yielded far less societal benefit than we were told. The Lancet paper detailed the results of what is known as a challenge study. Now, it's interesting. This is interesting. I don't know that we could do this study in America as well, but this was done in England. The participants were purposely infected with COVID-19. Then they were monitored in a controlled environment. Then they were tested for presence of the virus on the inside of masks worn by participants, their hands, and the air and surfaces in individual rooms that the participants were kept in for at least 14 days. So you purposely infect them, you keep them in a place for 14 days, you monitor and test for virus on the inside of the masks that they're wearing and their hands, the air and surfaces in which they're living. The authors found that just 7% of emissions into the air and environment from infected participants occurred before the first reported symptom. In other words, this fear of pre-symptomatic spread was not 30 to 50% as had been reported previously in other resources, but was 7%. David Zweig goes on to say, modeling studies as early as May 2020 had estimated that roughly 30 to 50% of community transmission occurred before reported symptoms, meaning 30 to 50% of the transmission was asymptomatic. But this challenge study just showed 7%. This study, called the Imperial College Study, bolstered findings from a study that David Zweig had reported on earlier this year, and that was at Stanford University. And that was where Stanford had developed a unique PCR test to not simply determine if someone had COVID, but to determine if they were infectious, if they were shedding virus. The researchers in that study found that 96% of people who were PCR positive, meaning they had the disease, but without symptoms, were not infectious. So if they had a positive PCR test, but they didn't have symptoms, they were not infectious. They were not spreading. Together, he says, the findings from both the Stanford and the Imperial College studies make a strong case that pre-symptomatic and or asymptomatic transmission was fairly uncommon. That's what David Zweig had to say here. And then he says this, we were made to believe that each one of us was a potential, unwitting, one-person weapon of mass destruction. As a result, healthy people's lives were upended in the name of slowing the spread. The social distancing policies, the quarantining of healthy people, the closures of schools and businesses, the forever masking of children imposed massive societal costs. In other words, he closes with, had schools, as they did in Sweden, and most of society simply followed the classic advice, if you're sick, stay home, we likely would have ended up in a similar place, yet without all of the collateral damage. The article that he referenced earlier in the year that he had discussed the Stanford study had some interesting comments as well. In that article, he had indicated that the novel test at Stanford had showed a very low rate of infectious asymptomatic people who had tested positive, was available as early as May 2020, yet the CDC and other health authorities did nothing. He went on to comment that in June of 2020, Dr. Maria Van Kerkhove, you might have remember her, she was the head of the World Health Organization Emerging Diseases and Zoonosis Unit, had said that transmission from asymptomatic people was very rare, but then she had to walk it back later on in another interview. The British Medical Journal in December 2020 said, searching for people who are asymptomatic yet infectious is like searching for needles that appear and reappear transiently in haystacks. And yet other views went in other directions. And David Zweig references the JAMA Network Open article that said more than half of all transmission came from infected people without symptoms. So we're all over the map. But we had data in 2020 that demonstrated that there was a test that we could have done that Stanford had devised, because the COVID-19 is a positive RNA strand of RNA, and that's the nature of its makeup. In order for it to replicate, it has to create a negative strand. So it's a positive, it has to create a negative. So the Stanford folks had come up with this test. Well, let's see if the negative template, the negative strand of RNA is present, because if it isn't, then it's not replicating. And if it's not replicating, it's not infectious. So that's really what happened there. But we had evidence that year in 2020. We had more evidence. There was an article in November of 2020, Nature Communications. It's on the NIH website. And this was a study done by Chow and Gan, and I believe there's several other articles. But the bottom line is they tested people. And what they did is they basically imposed control measures in Wuhan. And this is the key sentence in their study. There were no positive tests among 1,174 close contacts of asymptomatic cases. In other words, they found people that were positive for COVID, asymptomatic, and they watched them to see if any of their contacts became positive. There were no positive tests among 1,174 close contacts of asymptomatic cases. That was a watershed article that should have absolutely woke us up. If you look at an article in the British Medical Journal, December 17th, 2020, a month later, the title of the article is COVID-19 Response, Retrieving Sanity. It says this: there's increasing evidence, first from Wuhan, and then a meta-analysis of household spread, demonstrating that asymptomatic spread plays a minimal role in transmission. Madwell et al. Findings indicate that it contributes less than 1% of cases. Confirmation of the very low transmissibility of cases with higher PCR cycling thresholds indicates that cases and deaths are greatly overreported. The recent urgent notice from the World Health Organization that high cycle threshold value results in these PCR tests should be treated with suspicion, and cases should be defined based on virologic and clinical evidence. Went on to say this: lockdowns can be expected to kill through increased poverty, delayed or denied medical care, and perhaps through psychological stress. Goes on to conclude, we need evidence-based, less harmful ways to cope. I remember wondering why in the world I wasn't, as a physician, when I was given a positive PCR COVID-19 test on my patient, why wasn't I also told how many cycles this had been utilized, this test had utilized in order to get this positive test? If it had been 30 or under, that would be fairly clear evidence that this might well be an infectious case. But when it's 45, many medical authorities across the nation have said this was relatively useless, because, as Tony Fauci had said, you might well just be picking up dead nucleotides and nothing more. There was another article in 2020 in December. The title was Asymptomatic Transmission of COVID-19. Alison Pollock, a professor of public health, and James Lancaster, a researcher, said, unusual in disease management, whereby a positive test result is the sole criterion for a case. And then they're basically saying a positive test result being the sole criterion for a COVID-19 case. Went on to say this: normally a test is a support for clinical diagnosis, not a substitute. For instance, if I have a patient come in with nonspecific urinary symptoms, maybe they're going to the bathroom a little bit more often, maybe they're peeing at night a little bit more often, and we run a urine test. There's a thing called leukocytes or white cells in the urine. Oftentimes I'll get a positive test where it'll say trace leukocytes. Trace leukocytes as a standalone result would be considered an uninteresting finding, that we wouldn't respond to it. But if it's in the context of low-grade fever, burning on urination, and increased frequency, then that test would be considered indicative that there's a problem, and we would do a urine culture. And if the culture were positive, we would have the bacteria generally nailed down, and we'd know exactly what to treat with, because we would do antibiotic sensitivities on top of that. But if this is a standalone thing, and perhaps I'm checking someone's urine to see if there's sugar in their urine, and I get a trace leukocyte, that's a false positive test. It's not meaningful. It would be used to support my diagnosis if there were other contextual data points present. But if it's a standalone, oh, by the way, we would consider it more of a red herring false positive. That's what they're saying. See, this is how medicine works. But during COVID-19, we were told that if you had a positive test, even if you cycled it 45 times, voila, you've got COVID-19. If it's a hospitalized patient, put it on the discharge diagnoses as one of the discharge diagnoses, and there could be financial implications that may be favorable for the hospital, the doctor, the patient, everybody concerned, except potentially for anybody who's concerned about our national debt. But having said that, I think that we're seeing right now too many conversations about forcing people to wear masks, potentially coming up, about vaccine mandates for kids going to school. You see, this all got started because of this fear of asymptomatic transmission. Everybody was a potential boogeyman that was going to spread the disease. And that was fueled by an incredibly flawed testing program whereby we cycled 45 times so we could get virtually a vegetable, a banana or some sort of vegetable, to test positive. And that fueled the whole thing. And then on top of that, we started quarantining, and we started accusing one another, and we created snitch lines. We absolutely went off the rails, and we have a chance to learn now. We have to learn now. Telling a senior in college that they can't finish their program this year because they refuse to get vaccinated because they've already had COVID and they've got antibodies, which are easily tested on a $40 test. This is wrong. And telling people they have to wear masks and potentially bringing these kinds of policy decisions back into play. I mean, I was at a football game last night. There were 50,000 people, all enjoying themselves. I was at the state fair yesterday. There were 100,000 plus people, all milling about, bumping elbows, chewing on mini donuts and chocolate chip cookies. There wasn't any fear, but the fear will come if we manufacture it. And that's what's been happening. So I would plead with physicians and medical authorities, but most importantly, American citizens. Let's not go down this rabbit hole again. We've been there, done that. It didn't work. The states that didn't go as hard towards some of these policy decisions as maybe other states did, those states did fine. Sweden did fine. This whole thing got going because of this incredible fear of asymptomatic transmission, that no one could know who was going to spread it. For that reason, we saw people like Tony Fauci jump from don't bother wearing masks to wear masks all the time, wear 3 masks, 5 masks. It got just crazy. And it was fueled by the fact that our PCR testing programs were just wildly wrong. I don't know if you remember the New York Times article where they talked about more than 90% of people who had been told that they were infectious for COVID-19 probably weren't. They were just false positive tests. We got to stop it. There's a tremendous amount of medical literature and rational, logical thought that tells us we should not be going down this road again. And yet, it feels so much, if you look at the conventional media today, that we're being driven down this path where we're going to rinse and repeat failed policies of the past. Happy Labor Day weekend.